Kennel cough, also known as canine infectious tracheobronchitis, is a highly contagious respiratory disease in dogs. It is characterized by inflammation of the trachea and bronchi. The condition is similar to a chest cold in humans and can be caused by a variety of pathogens, most commonly the bacterium Bordetella bronchiseptica, but also by viruses such as canine parainfluenza virus. The primary symptom of kennel cough is a persistent, forceful cough that often sounds like a goose honk. Other symptoms may include gagging or retching, nasal discharge, sneezing, lethargy, loss of appetite, and mild fever. Cough spreads easily in environments where dogs are in close contact, such as kennels, dog parks, grooming facilities, and shelters. The disease is transmitted through airborne droplets, direct contact with infected dogs, or contact with contaminated surfaces. Veterinarians diagnose kennel cough based on the dog's clinical signs and history. In some cases, further diagnostic tests, such as chest X-rays, bacterial cultures, or PCR tests may be performed to identify the specific pathogens involved. Most cases of kennel cough are mild and resolve on their own within 1 to 3 weeks. Treatment may include cough suppressants to provide relief, antibiotics if a bacterial infection is suspected, anti-inflammatory medications to reduce airway inflammation. Preventative measures include vaccination against Bordetella bronchiseptica and other respiratory pathogens, avoiding contact with infected dogs, ensuring good hygiene and ventilation in places where dogs congregate. The prognosis for kennel cough is generally good, with most dogs recovering fully. However, in puppies, older dogs, or dogs with pre-existing health conditions, the disease can sometimes lead to more serious complications such as pneumonia.